Good morning. This week we're going to start a series. We're going to do a three-part series about when doctors don't listen. I promised you no politics, but there are a little bit of politics involved in this series because it's the politics of the medical profession. There will be a little bit of conspiracy theories, which I believe in. I do believe that some doctors conspire against their patients in order to keep their business up. They don't want to do procedures that would make it uh, that the patient no longer has the need for their services. So we're going to talk a lot about this, and I have a special message today for my male viewers and subscribers. Please don't turn this off. Yes, a lot of what I'm going to be talking about is the fact that women are more likely to not be listened to or ignored by their doctors, their wishes ignored. But that doesn't mean that these shows don't concern you. Because all of you guys out there, my lovely male viewers, you have women in your life who you care about. Mothers, wives, sisters, nieces, cousins, girlfriends, friends. Every man has a woman in his life that he wants the best for, that he cares about. So you need to listen too, because you play a major role sometimes in the kind of medical care that women get. It is so unfortunate that for the most part, and I've talked about this on shows before, that a man can walk into a doctor's office and demand things and get them. No questions asked. And one of the major things that a man can demand is permanent sterilization. Now, I'm not going to go back over all the crap that a vasectomy is cheaper than a woman's tubal ligation, and that a man at any age, at any time in his life, single, married, father, not a father, can walk into a urologist's office and say, I never want to be a dad, do the snip, and they get the snip. They're not told they're mentally ill. They're not told they're going to change their minds. They just get their vasectomy and walk out the door, put a thing of frozen peas on their penis for a couple of hours, and they're good to go. The saddest part is that it's not only male doctors who don't listen to women. Female doctors are just as bad. And I've had experience with both. And I've had the same outcome with both. They don't listen. It's very unfortunate. I think female doctors, a lot of women I know say, I'll only go to a female gynecologist because I don't feel comfortable with a man. And a woman will understand because she's a woman. No, see, I found the opposite to be true. And I find this both in male and female doctors, but in a female doctor, when I would tell a female doctor, and I never really had a female doctor. Let me just do this. I went to Planned Parenthood, and the woman that I saw every year for my annual exam that I was forced to get my birth control, which they forced me to get because they wouldn't tie my tubes and permanently sterilize me, she was worse than the men. I mean, she was vicious with me. Well, your husband's a pussy. Your husband should get a vasectomy. What? What? First, in one hand, she's saying I should get off birth control. We're going to talk about birth control today. And second, she's saying, but I'm not going to tie your tubes. Why not? That's how I can get off birth control, because I never want to be a mother. I don't want to get pregnant. I don't want to have babies. I'm 40 years old. Tie my damn tubes. No, see, your husband needs to get a vasectomy, and if he refuses, that's his problem. I wish my husband would have been in the room with me. This is why this show is for you guys, too. Go to the doctor with your wife for her female visits. Listen to the way the doctors talk about you behind your back. My husband would have slapped that bitch into the next room. She's calling him a pussy because he won't get his penis cut. No, my husband didn't want to get a vasectomy. Big deal. Plus the fact vasectomies, as I know from other women's personal experiences, vasectomies are not 100% accurate. I know a woman who got pregnant with twins. Her husband swore they weren't his. He had a vasectomy. Oops. He went to the doctor. They did a test. Oops. Vasectomy didn't take. All these years he'd been having sex, he thought he couldn't get a woman pregnant. Oops. Tubal ligation is not all that horrible. And now, under Obamacare, one of the good things about Obamacare is insurance has to pay for it 100%. But doctors won't do it because they don't listen. You all know my story. When I was 25, I got pregnant by accident, on birth control, by the way. And I had an ectopic pregnancy and I almost died. And after that, I said, okay, I'm good. I got the message. I'm not the kind of person that really ever kind of wanted to be a mother in the first place. So why don't we just tie my tubes, permanently sterilize me, and I'm on my way. Oh no, the doctor said, you're going to change your mind. I'm going to deliver a healthy baby for you one day. And I'm like, no, see, I'm not going to risk my life to have a child when I don't even want to be a mother. No. No, see, again, the doctors are telling me that there's something wrong with me because they bring their own agenda to the table. Doctors are human beings. Male doctors, female doctors. I have a feeling the female nurse practitioner or physician's assistant, she wasn't a medical doctor, but she did my pap smear every year at Planned Parenthood. And I have a funny feeling that she was thinking about herself, possibly her daughter, her niece, her sister, and what I was telling her I wanted, she was thinking to herself, well, I wouldn't want my sister to do that. I wouldn't want my daughter to do what you're asking me to do, permanently sterilize you, when you got some fertile years left. Well, see, your family's situation is not my problem as your patient. You're supposed to listen to me and to what I want. Because I don't look at you in my mirror, and I don't have the financial situation that you and your family have, and I know what I want for my own body. I don't live in your body or your daughter's body or your niece's body or your sister's body. I told you all about my first OBGYN who did the ectopic pregnancy surgery, who absolutely thought he was going to someday deliver my firstborn child. Well, he didn't, because I never had one. But he was Catholic, and he had 7 children of his own. Perhaps his religious beliefs played into how he responded to me. He wasn't listening. He told me to go get counseling after I almost died. I did go get counseling. I was in counseling for 2 years. We talked about the ectopic for a month. Then we talked about getting me over my bulimia. Getting me over the bulimia, that worked. I'm not bulimic. But I still didn't want to be pregnant. I still didn't want to have children. And he still refused to tie my tubes. Now, most of you have heard this before, so I'm not going to go on and on and on about how my wishes were ignored. We all know the outcome of my story. It was a happy ending, maybe. This is what the show's about today, because I don't know if it was a happy ending yet. I thought when I went into menopause early how lucky I was, but I was still on birth control, sentenced to 19 years of birth control by doctors who refused to listen to me and accept the fact that Paula Luciano is never going to give birth to a human person. And I have learned recently that I'm not quite out of the woods yet just because I am done with menopause. Here's the thing. Doctors will tell a woman that they have a lot of options other than permanent sterilization if they don't want to be pregnant for now. Options that will allow them to change their minds later and become normal women. Because to be honest with you, come on, watch TV, look at the news, look at the laws that are being made. It's all about children. If you don't want children in this country, you are considered abnormal. You're not right, especially if you're a woman. If you're a man, all right, dude, you got the snip snip. Now you can fuck anybody you want and not worry about child support. But a woman telling a doctor she never wants to be pregnant, oh my God. They lose their minds because they don't listen. They don't listen to the why. For example, I'm a selfish person. I'd be a bad mother because I'd rather read a book or play a video game than change a diaper or take my kid to soccer practice. I know that about myself. I'd rather spend money going out to a fine dining restaurant than for my kid to do ballet class. That would annoy me if I couldn't go out for dinner because my kid has ballet. I don't want to go to school plays and recitals. I don't want to help kids with their homework. That's not me, but nobody listened. They just said, use the birth control. So I did. I was on the pill. And when I was 35, my OBGYN, the Catholic dude, said, I can't prescribe the pill for you anymore because you smoke legal cigarettes. It would put your life in danger. You know what put my life in danger? Getting pregnant. That's what almost killed me, not the birth control pill. So there was an option. Of course, the option wasn't tying my tubes and permanently sterilizing me so I could just be done with it. It was Depo-Provera. Guess what I just found out about Depo-Provera, the birth control shot? And all of you ladies out there, or men who love ladies who are on the Depo-Provera, has your doctor mentioned the pseudo-tumor? Yeah. It's new, although it's not new, it just was never presented to me. When I was on Depo-Provera, the first inkling that I got that there was a serious side effect. The side effects were not all that bad. They said weight gain. Well, I'm pretty good about controlling what I eat, so I didn't gain weight. Depression. Well, I'm always kind of bitchy, so that wasn't a big deal either. And then they started talking about osteoporosis. And I'm like, well, gee, would I rather be pregnant and die from another ectopic pregnancy or maybe someday get, osteoporosis? All right, I'll accept that risk. Here's what they forgot to tell me about. And they knew about it as early as 2004. At that point, I had been on Depo-Provera 2000, 6 years. And they were bitching and moaning and groaning and pushing the osteoporosis. They never told me about the pseudotumor. Now I find out that women who have been on Depo-Provera and other forms of birth control, by the way, there are lawsuits. A pseudotumor is not cancer. Good news, right? Oh, but it causes blindness. My in your brain. And you know what? You know how you diagnose it? Well, you go to the eye doctor and they do some kind of crazy stuff to your eyes to see if you have it. I mean, seriously. These doctors are so worried that if they tie your tubes, you're going to come back and change your mind and go, oh my God, why did you do that? So they would rather let you use a drug that can make you blind? Paula Luciano cannot go blind, people. Paula Luciano reads 2 books a week. Paula Luciano reads all day long on the internet. Paula Luciano loves television. I am no Helen Keller. I am no Mary Ingalls. I won't do well as a blind person. In fact, it's in my living will. I go blind, I get to go to California or wherever that lovely Brittany Maynard went, and I get to kill myself. No offense to any blind person who is happy being blind. But I'm 53, almost 54 years old. It's a little too late to learn something new, like how not to see. And add insult to injury to go blind because of birth control? Are you fucking kidding me right now? When I begged and pleaded and went to doctor after doctor after doctor and said, I never want kids, tie my tubes. And they kept going, no, you'll change your mind. Every woman who's capable of having a child should want one. Sounds like Handmaid's Tale to me. I said I never wanted to be pregnant, and I proved it by being on their pharmaceutical side effect causing drugs for 30 years. 30 years. That sucks. Putting myself at risk for these side effects. The only prescription medication I have ever been on was birth control. And now I find this out. And how did I find it out? From a news article, not from a doctor who kept saying, we won't tie your tubes, we'll just give you the birth control. Oh, be careful, Depo causes osteoporosis. They never told me it could cause me to go blind, but they knew about it. From 2004, and I went off Depo-Provera in 2014, 10 years. Not one doctor told me the possibility that my birth control could cause blindness. A tumor in my brain. Knowing that I was willing to go under anesthesia and have my tubes tied. So I wouldn't need their pharmaceutical drugs anymore. You know what else I wouldn't have needed when I went off the birth control? I wouldn't have needed their yearly pap smears and their yearly annual exams that cost $200. They wouldn't have gotten that either. E-Sure is another birth control method where there's a bunch of lawsuits. In fact, almost every birth control method right now has a class action lawsuit against it. Women are dying. Or they're getting pregnant and having ectopic pregnancies. They're having emergency surgeries. And they're getting cancers because of birth control. And the answer to solving these birth control side effects is allowing women to walk into their doctor's office like a man does and say, I don't want any children. And I want to be permanently sterilized. And have the doctor go, yes, ma'am, let's do an exam, make sure you're healthy for surgery, and let's get it done. They don't do that. So we already know the side effects of birth control. They cause cancer. Now there's this tumor, causes blindness. Oh, but it's not cancer. Don't worry. You'll keep your hair. You just won't be able to see to style it. Yeah, nice, huh? Here's the side effects from a tubal ligation, tying your tubes. Yes, it is surgery. Yes, you go under anesthesia, which is always risky. But you walk into the hospital, you get your tubes tied, and all goes well. You walk out the same day, you take a couple days off work, and it's done. You don't get a pseudo tumor, you don't go blind, you don't get breast cancer and all kinds of other cancers. You don't get osteoporosis. Sounds like a no-brainer, doesn't it? But again, doctors don't like that option. And I'd like to hear some comments from those of you who have been through what I've been through with trying to get permanently sterilized as a female, as a woman. They say women have all these choices now, right? Except this one. And the saddest thing of all is this one could save your sight, could save your life. Choosing to be permanently sterilized when you know you want no children or are done having children can save your life from the side effects of these pharmaceutical drugs. But go ahead, try it. Tell your doctor. Sadly, so many of them just won't listen. Political Paula, out.